about to go in. Yeah. Hey guys, welcome to Dee's World. This video was recorded that I'm about to show you guys was recorded about almost 2 years ago. My husband went in for his ICD procedure, and before we get into all of that and what is an ICD, I'm going to remind you my husband had a widowmaker's heart attack some years ago, and he got some stents placed in his heart. Now, I always tell my husband that he has a fixed heart and not a bad heart. Because you got to think, it's a lot of people that are walking around and have no idea that they have a bad heart because they don't go to the doctor, they don't do their regular checkups, they have no idea. But my husband, because of what happened, he now knows, hey, this is, I can't eat this, I can't eat these certain things anymore. So he has a fixed heart. He has the stents in there, which is perfect. We also, I remember that day of that they did the stents, he talked to a 70-something-year-old man who he had like over 20-something stents and has had them since his 30s. So you can live a normal life with stents, okay? Now, the ICD is a preventive measure. At first, you guys, I did not want to do the ICD implant because I thought it was just unnecessary. And then at first, I thought it was a pacemaker. But his cardiologist explained to me, he said, this is not a pacemaker. This is a preventive measure. Basically just saying, hey, until we want to monitor his heart rhythms, we want to monitor his heart. We want to see when it's doing great. We want to see, how we want to be able to monitor it, which is good. He said that it's a preventive measure because if his heart go beat out of rhythm, it will, shock the heart. But he said 75% or more patients don't have to never get shocked. So he said it's totally advice. It's not like a pacemaker. So I was thinking, oh, it's a pacemaker. Why does he need a pacemaker? But it's not that. So this is the machine that is connected to the ICD, and this sends back signals to his cardiologist. So his cardiologist can know exactly how his heart is doing. Okay. If it's beating too fast, if it moves out of rhythm, I mean, it's something to help. It is not nothing like a pacemaker where you have to totally depend on that machine. So ICD is totally different. But it's almost like, how those, is it the same thing like an Apple Watch where it shows you how your heart is going in rhythm and all that? It's something like it, but not really. So in the video that I'm about to show you, we actually vlogged the entire thing, with him going to get his ICD placed. I was nervous, but we did it. Okay guys, so today we are going to get, okay guys, so we're up early. We're going to get a ICD, and I'm going to kind of go over everything, what that is. Remember my video I made from when Adam had a widowmaker's heart attack. He's been doing amazing. I'm going to also do a update video too, to show you guys like what he's been eating and how he changed his diet and all that stuff. But this particular procedure is a outpatient procedure. It's not like serious surgery, but this is more like a preventative type of measure where they place it under your skin, because right now his heart capacity hasn't gotten back up to where they want it to be, but we're on our way there, but it hasn't gotten there yet. And they just want him to place that under his skin just in case he needs it. And what it does is if he ever has an out of rhythm heartbeat, it will shock the heart back to where it needs to be. And they said over 75% of the patients that get this never have to use it. So that's a good thing to hear. Okay, so like Adam said, he would rather have it and not need it than not have it and need it. Okay, so yeah. At the doctor's office, you guys. We're at the doctor's office. Can't see anything, but this is it here. And we're gonna say a prayer before we go in. Are you nervous?
A little bit. A little bit.
You're a little bit nervous?
Yeah, but I'm gonna be okay.
Okay. Going inside, you guys, and I'm gonna give you all a bunch of information so if someone else is going through this, they can learn from it as well. Got our mask on, right, honey? We said a prayer in the car before we came in. There we go. Honey,
Feel good. Ready.
are you a little nervous?
Yeah, a little bit nervous, but I mean, anybody would be a little nervous. So I mean,
Now, why did you decide to get it? Because you didn't have to get it, but why are you deciding to get it?
because I'd rather have it and not need it than not have it and need it. I mean, wait, I think I said that wrong. I'd rather have it and not need it than not have it and need it.
Mm-hmm.
So,
Okay.
you know,
Yeah,
preventive measure.
exactly. Yeah. About to go in. Yeah. Okay, guys. So I'm, just in the waiting room here. The TV. It's all right there. So basically, I'm just waiting until he comes out of his outpatient surgery. Am I nervous? I am not. I think leading up to this and trying to make a decision was more hectic for me because I was trying to say, like, is this something that he needs? Do he need to do this or anything? And I just let Adam ultimately make the decision because it's him, it's his body, and he wanted to do this. He wanted to do this. And he made it very clear to me. He said, hey, 75% of the people who get this don't need it. He said, but and he knows he's not going to need it. He said, however, he would just still rather get it and not need it than not get it and need it. So I'm just waiting. I know God is with him while he's in there right now. They took him committing curtain here, and he's in the surgery room, so I'm just waiting. And so I'm gonna give you guys some more details about it and everything, but I feel good about it. I feel really good about it. I feel really good about it, and I'm just happy. I don't like how my hair is looking like. But yeah, I feel really good about it, and I hope you guys can hear me. I'm trying to keep my mask on, but I feel really good about it, and I hope this video is going to help some other people that are thinking about getting one as well. But yeah. Are you afraid to get the, what?
ICD?
So what is the difference between an ICD and a pacemaker?
Yeah, so ICD is more like a preventative measure, where it's like a defibrillator if you need it, but a pacemaker is more for those who actually need something to make their heart function. Like my heart functions fine by itself, it's just arrhythmia and goes out of rhythm, then it'll give me a shock to shock it back into rhythm. For something that feels like it sticks.
Okay. Now, how was the experience in there? Anything when you were getting this place?
Very little. I felt, so I looked at the procedure before, so I kind of know exactly what was happening. I was feeling where they were breaking the skin away from the muscle tissue and everything like that, so that they could make the pocket to insert the ICD. But I mean, it only felt like a little, like almost like if somebody hit you with static electricity.
Okay, that's what it felt like. Right. Okay. Do you feel the same with it inside of your skin? So, okay, another question. I'm sorry. Did they go deep down in your chest, or was it just under the skin? Under the skin, right?
Right, it's just directly under the skin.
Okay.
You asked, do I feel different? Yeah, I'm a robot now. Just kidding. I'm just kidding. No, I don't feel different.
You don't feel different. Okay. Let's see. Feel any tightness in your chest?
Yes. Yeah.
Not tightness like from breathing, like you
right.
about to have
Exactly. No, you feel the tightness of the skin because it's basically like if you had something that's skin tight, right? Mm-hmm. And then you push something in there, you're stretching out the skin to go around whatever it is that you inserted in there. And so that's the tightness that you feel. You feel that, I mean, it's not unbearable of a nagging type of thing than
Okay.
it is like painful.
Okay.
It's
Let's
almost like
see.
your skin is really dry.
Now, sleeping positions. How do you sleep? How did you feel sleeping the first night?
It was terrible, honestly.
Really?
Yes. I was constantly felt like I had to turn because I'm a side sleeper.
Okay.
So
Sleeping.
yeah, so I'm a side sleeper and I typically sleep on my left side. But of course I can't lay on that side because I can't put any pressure on there because it could pop the sutures out. So I was constantly having to adjust from sleeping on my back, but then at the same time also keeping my arm in a certain position and sleeping on my right side, which is uncomfortable for me because I'm not used to doing it, I guess. But yeah, it was pretty horrible the first night. I'm hoping the second night's a little bit better. Also, the arm tends to get a little stiff because you're kind of locking. It doesn't do any movements it's not supposed to during the night.
Okay. Let's see. Can you take showers and baths with it?
I can't take a bath right now. I can in the future once the wound is healed, but right now I can't take a bath. And I can't really I can take a shower, but I can't use like any soaps or lotions or anything like that in that area as it can cause it to get.
Okay. Let's see. Can you pick up anything? Can you drive?
No, I can't drive for 7 days. I can't pick up anything over the weight of a half a gallon of milk for 2 weeks. It's definitely pretty frustrating, especially being that it's my dominant hand. And so I'm used to picking up things and, using the hand a lot, but I can't put my elbow past my shoulder.
Okay.
Or I can't like reach behind my back or anything like that side.
Okay, and also too, do you think you can't reach above your head and you can't drive because of where they placed it, or because it's just
It's more,
protocol for it's
right.
just
It's more of the protocol. You can't go above your head because then you're pulling on the sutures and you could pop it back open, which all over the place, or you may infect the wound.
once it's all
And the
healed.
driving is due to they don't want you to have any like jerky motion.
Oh, okay.
So like if you have to suddenly step on the brakes, then it jerks you forward, and it could cause that to jump forward.
And once it's all healed, you can go back to working out and all of that stuff, right?
Yes, I can work out just fine. Of course, making sure keep the heart rate in a certain level, but yeah, I could still go back to working out, running, walking, whatever it is you want to do, really.
Okay,
Nothing.
great.
Oh, no heavy. It's still no heavy lifting, like no heavy bench pressing or anything like that.
Oh,
Still.
of course, yeah. Okay,
Because every
and
time you come down, you'll come down right on
exactly.
the ICD.
Okay, and I noticed that it's a little swollen. Will the swelling go down?
It goes down probably after a few weeks or whatever.
Okay. Okay, perfect. And why did you overall get it?
Well,
Decide to get it?
I got it because you know, it's a preventative measure, as they said. So, I would rather have it and not need it than need it and not have it. So I mean, because in the case that you do go into cardiac arrest, I mean, you've got a very small window. It could be fixed without you dying. So with having the ICD, I don't have to wait for the ambulance to come and hit me with defibrillator paddles. It's right there planted in my chest. So once it notices that irregular rhythm, it'll automatically give me the shot that I need, or however many shots you need.
Okay. And how many people need the shock? Like the percentage of people need the shock for the thing?
From what I was told, it was
Don't need it. I'm sorry, don't need the shock.
75% in
Okay,
this lifetime.
which is great.
Maybe only a fourth of them do ever need to get shocked by the ICD.
But majority don't.
Right, but a majority don't.
Let's see here. And your heart capacity still is going to go up, right?
Yeah, my heart
so
capacity
if
can
your heart capacity is below 30, they recommend this, right?
Correct.
And once your heart capacity go above 30, you can still keep it in. You just keep going and moving forward, go up, right?
Well, yeah, it's unremovable because of the leads that go into your actual heart. So you can't remove it because it's too dangerous to pull them back out. But they can deactivate the device.
Okay, once it goes.
Yeah, once you hit that level that they're looking for your heart capacity to be at.
Okay, great. All right, perfect. And so you can live a normal life, long life with this.
Absolutely.
Okay, perfect. All right. Thank you. Bye.
No.
So guys, look at that. The scar it doesn't look bad, does it? So they literally had to. Okay, so yeah. Now you guys, that didn't look that good at first. Remember, hon, it took a
while.
it took a while. It was like puffy at first, the swelling. He had to keep it clean and all of that stuff, but other than that, it looks good now. Like a little at first, I don't know if Adam could feel it, but at first, babe, when you first got it, I felt the bump more, but now I don't feel it as much.
Mm-hmm.
It's almost like it just, I don't know, I feel it a little, but I don't feel it as much. Like when you first got it, I remember you couldn't pick up Alex, like pick him up over your head and all of that.
Mm-hmm.
But why do they say you can't like pick up people and stuff, just in case someone else is thinking about getting an ICD?
Oh, well, I mean, it's just so you don't cut the incision open.
Oh, okay.
Yeah.
Okay, so but once it's healed,
Mm-hmm.
you can go back to like picking up on your kids and all of that stuff.
Mm-hmm.
All right, guys, than Adam was, but everything worked out and he got it done. Okay, so again, this is something that if your cardiologist bring it up to you, you don't have to be afraid of it. ICD is something to help you. And what you always say, babe, you rather
Be safe, have it and not need it, than need it and not have it.
Because I was so nervous. I'm like, do you need this? What are we doing? But it's really helpful. And again, this is the machine, and he literally takes the machine, takes it off of the machine like this, and then he puts it on there, and that, I guess, see, there go the light right there, and that signifies it, I guess, to your.
It communicates back and forth and relays information.
Okay, it communicates back and forth, and it relays information to his cardiologist.